Would a government do this if they put fairness at the heart of all policy making? These are data from England, from the UK, and it shows child poverty. Child poverty was coming down, and the dotted line, look at the top two lines, the dotted line shows what would have happened because of the economic downturn were there no change in policy by the current coalition government. And the solid line shows that government policy is increasing child poverty. Child poverty is bad for health. We know that. I show these figures to the government, not to make party political points, because I say we care about our children. I couldn't care less about Conservative, Labour, Republican, Democrat. I couldn't care less. I care about our children. And I was talking to the American Medical Association. I know, don't throw me out. I was talking to the AMA at their invitation. And I said, would there be a politician in the United States, I can't believe there would, who'd say, I don't care about our children? They said, you'd be surprised. We said that monitoring is vital. My first recommendation was equity from the start, give every child the best start in life. So we've been monitoring child development by level of deprivation of local authority. And what you can see, the more affluent the local authority, the better the level of early child development. The more deprived, the worse. So one strategy to reduce the inequities in early child development, which are crucial to the latter development of health inequities in adult life, one strategy is to reduce social and economic disadvantage. If we could bring the bottom end up towards the middle or towards the top, we could reduce the social gradient in early child development. You'll also notice there's scatter around the line, which means for a given level of deprivation, some local areas are doing better than others. And that's the second strategy, to intervene, to say, as one local authority said to me, poverty is not destiny. We tell ourselves every day that poverty is not destiny. So let's look at this briefly. When we look at how well the UK is doing, because, sorry to come back, the median, one of the frightening things about that graph is the median was 56%. In other words, only 56% of children are classified at age 5 as having a good level of development. And I asked myself the question, is that feasible? There must be something wrong with the measure. But when we look at OECD countries, at equality in child well-being, we see this. Now, in the European context, one Minister of Health said, as I was presenting the results of our review of social determinants, I don't think WHO should have anything to do with social determinants. Health is a matter of personal responsibility. I said, don't blame the children. You can't blame the children for choosing their parents. They didn't choose to be born in poverty. I won't tell you which country it was, but it was the Netherlands. And I said to her, you're right at the top. Do you want to pull the ladder up after you? We want every country in Europe to have the social conditions that improve life chances for children. You'll notice the rankings here. The UK is way down at 5. I have to say, I do like coming to the United States. The only big country that makes me feel better about my own. Can we do anything about this? Well, yes, we could. This is from our European report. Look at Latvia and Sweden. This is child poverty, where poverty is defined as less than 60% median income, before and after taxes and transfers. Before taxes and transfers, child poverty in Latvia was 35% and in Sweden was 32%. After social transfers, child poverty was still up at 25% in Latvia, but was down at 12% in Sweden. In Slovenia, which is not a rich country, even lower. The level of child poverty is a decision the government can make. How does the US do? If you're of sensitive disposition, I suggest you look away now. The US is doing worse than Latvia. You're a functioning democracy. This must be what you want. Why on earth would you be complicit in electing a government that chooses to have a level of child poverty greater than Latvia? Perhaps you don't have enough money. Well, you do actually. This is the 1%. In 1928, the top 1% of income earners had 23% of total household income. And you remember what happened next? The Great Crash went down to, the share of the top 1% went to less than 10%. And then it built up. So in 2007, the top 1% had 23% of total household income. And you remember what happened next? Now, I'm a careful scientist. I would never claim that correlation is causation. I could not claim that it's proved that the unconscionable greed of the top 1% brought the world's economic system to its knees. But you have to admit, it's a credible hypothesis. I couldn't possibly comment. On the eve of World War II, W.H. Auden wrote, "In the nightmare of the dark, all the dogs of Europe bark, and the living nations wait, each sequestered in its hate." I'm concerned that in my society and in yours, too many are sequestered in their hate. We're hearing the language of the undeserving poor. We're hearing the language of them and us. I would say that health is what should bind us. I was asked this morning, would I give advice to young people? And I said, no, I'd never give advice to young people. I gave advice to my children. They didn't listen. Why should I give advice to anybody else? But what I did say is young people embarking on a career in public health, I would say to them, we are on the side of the angels. What we're trying to do is improve health for the whole of society. It's a way of binding society together. What a privilege it is to be working in that terrain. Now, I said there were two strategies to deal with the social gradient in early child development. One, reduce social and economic inequalities, but the second, take action. I was invited to the English city of Birmingham, which, like your Birmingham, is rather deprived. And if you look at the 2007 figures there, you can see that early child development levels in Birmingham were worse than the English average. Birmingham is more deprived than the English average. In 3 years, they closed the gap. They closed the gap. Hey, colleagues, isn't this amazing? They closed the gap in only 3 years. I have people beating a path to Birmingham's door saying, what did you do? And the answer is, it was pretty simple. We took evaluated programs off the shelf. The good science has shown us works. And we applied them. And it made a difference. It is rocket science. Why am I showing you this man with the untidy hair? You may have seen him on your television screens during the Olympics. We didn't let him compete in any of the events. Some of us are vain enough that if we had any hair, we'd try and put it in place when the photos, he goes like this clearly. This is the Mayor of London. When I was doing the English review, it seemed to me rather important that this not be seen as only social democratic or rather left of centre. He is the second most important elected conservative politician in Britain. He's conservative to the right of the Conservative Party, and he's the elected Mayor of London. And I went to see him, and some other time if there's an opportunity I can tell you about the hilarious conversation, but not now. And he said, what do you want me to do? And I went through the argument. They produced a health inequality strategy for London. And I read this, and I thought, this is terrific. I could have written this. And I read it again, and I thought, I did write this.